The definition of advanced prostate cancer is a fairly broad one, and people think of this in different ways, and it really includes a diverse or heterogeneous group of men, so men that may look almost nothing alike. In my mind, and I think in the mind of most prostate cancer experts, advanced prostate cancer is any prostate cancer that we know we can no longer cure, and I think that's a really important distinction, because after you're treated with a prostatectomy or with radiation, we all expect that one will be cured, and we know that that's not possible for everyone, and sometimes that disease comes back. And it's at that point that we often think that it's advanced prostate cancer. Now, some men who have a PSA that's rising after their initial treatment can undergo something called salvage therapy, and that is also given with the goal of trying to cure an individual. But if that fails, or if a man is not eligible for salvage therapy, it is at that point that it's incurable. So advanced prostate cancer includes anyone from a rising PSA that does not have any evidence of bone metastases or spread of the prostate cancer to the liver, the lymph nodes, or the lungs, all the way through someone who has spread of the prostate cancer to multiple places that we can see on imaging, into the bones, the liver, the lungs, or wherever it may be. So it's really this wide spread of men who have only a little bit of an elevated PSA telling us that they still have prostate cancer, all the way to men who have disease of prostate cancer throughout their skeleton or throughout their system that have now received multiple treatments to try to keep that under control. Metastatic prostate cancer comes in two flavors. The first one is hormone-sensitive prostate cancer, and this is prostate cancer that really has not been treated in the past with hormonal therapy or ADT, androgen deprivation therapy. This is typically the case when men are newly diagnosed with metastatic disease. And this type of prostate cancer responds to these initial hormonal therapies, these injections of whatever the drug may be, Lupron, Eligard, Triptorelin, and responds for however long it responds, but to hormonal therapy alone with these injections. The next stage, when the prostate cancer starts to progress while it's being treated with hormonal therapy, is something called castration-resistant prostate cancer. This is a more advanced form of prostate cancer that is no longer something that we can control with hormonal medications alone or ADT on its own. Castration-resistant prostate cancer can still be treated with hormonal manipulation with more advanced drugs that we have available, but it is also potentially treatable with chemotherapy, with radiopharmaceuticals, with immunotherapy, with things like Sipuleucel-T, and so the castration-resistant prostate cancer population has a more broad array of medications that are available to treat it.